Thank you, Amanda. See if the IT professional can work this out. Yes. Okay. So the Victorian Department of Health and Human Services has funded the Australian Cancer Survivorship Centre to develop a database of content for use in survivorship care plans, or SCPs. The database is for Victorian healthcare providers to assist with development of their own care plans, and the content is to be used in their own SCP templates. I know this audience is familiar with the role of survivorship care plans and are aware that despite being widely endorsed and recommended in optimal care pathways in Australia, their implementation has been limited. And as Jonathan demonstrated this morning, it's 5% use in Ontario, and Peter Mac had figures of 18%, so quite low. Currently, each healthcare provider is developing their own SCP content, and possible barriers to development include the time and effort required to source the content, and Raymond mentioned about the barrier of time this morning, and the lack of IT support systems. So, with this in mind, a database of current, evidence-based and agreed-upon SCP content will enable a statewide approach to information provided to survivors. The database will facilitate SCP development by healthcare providers by reducing the burden of collating all of this information. It will prevent the considerable duplication of effort across health services and leverages off existing work undertaken by the ACSC and others. It will streamline and standardise information to survivors after completion of initial treatment. I think I've gone too far, sorry. The project has oversight from a steering committee, and there's a similarly constituted reference group for each of the cancer types to advise on and approve content. Very happy to have several members of the reference groups here today, so thank you very much for all your help so far. Group members are from across metropolitan and regional areas, and yeah, thank you for your great work so far. The database content is written with the patient as the audience, so it's in plain English where possible. Is comprised of several essential components listed on the screen, and is developed in Microsoft Excel, as the previous slide said, and also we have a version in Access. So here we have some examples of content from the Excel database. The content would be, so you would select your treatments, you would copy then the side effects into a care plan, and so on. So we have treatments, side effects, wellbeing recommendations here. This is an ASCO template completed with content from the database. So the sections in yellow have been copied and pasted from the database into this template. I use the ASCO template because it's quite succinct. So what's next? A logical next step would see a development of a centralised database with a web-based interface similar to other SCP generators out there, such as Livestrong, but with local content, similar to what Lonica demonstrated was happening this afternoon. This will allow immediate update of content, will allow flexibility with how much content is displayed or output. It would be easier to access. You'd only need a web browser. You would need any other software, and it would be easier to use. Another possible next step would be to have an SCP database version created for primary care providers. And you could then include in the SCP what primary care providers look for and take out what they're not interested in. And it could also be used, for example, you could list side effects and possible management strategies. And thank you.
Thank you, Sandra. Are there any quick questions just at the moment? One over here.
Thank you, Sandra. So it's available after April, and how does one access it, please?
That's a good question. We're looking at ways we can deliver it with Peter Mac IT at the moment. Possibly, or most likely, it will be a link on the Peter Mac website where you can download the files, or there might be a registration system where we email the files out to you. If we have a registration system, then we can send updates if that is something that happens in future.